Hi, all. Welcome to everybody who has joined. If you're just joining me now, I usually give it a few minutes to let people trickle in before I actually start. My name is Dr. Chelsea Roshlive. I am the head sleep specialist at Wesper, and I do these weekly Wednesday seminars all about sleep apnea and CPAP, and just to kind of educate the public about how they can make their lives easier with sleep apnea. So we'll give it a few more minutes and hopefully we'll get more people to join tonight. Um, and as always, please feel free to ask questions during the seminar. If you have an immediate question that's related to something I'm discussing, just throw it in the comment section and I will happily answer that for you. Okay, I think we're going to go ahead and get started. So again, welcome to everybody who's joined today. As I said earlier, my name is Dr. Chelsea Roshlive. I am a sleep expert and neuroscientist, and I work for Wesper. We're a sleep health company. I like to do these webinars every Wednesday night to help educate people about sleep apnea and just how to live better with sleep apnea and treating sleep apnea. So most sleep apnea patients will ultimately be placed on CPAP. There are a wide variety of therapies available, but CPAP is by far the most common. And so today I wanted to discuss what kind of support system you should have in your life while you're dealing with getting your diagnosis of sleep apnea and once you get placed on CPAP and trying to deal with all the issues that come along with CPAP. I'm also going to talk about some of the do's and don'ts of using your CPAP machine to make sure that your treatment is as successful as possible. So as usual, please feel free to drop your comments. If you have questions, I'm happy to answer anything, even if it's not necessarily related to this specific topic. Any questions about sleep, sleep apnea, sleep health, sleep science, or even the brain, if that's something that interests you, just drop those comments below and I'll go through those comments and answer your questions. Also, if you're interested in attending these webinars weekly, feel free to drop your email in the comment section and we'll sign you up for notifications. We can also send you a quick guide about each seminar weekly, so you have that handy. Okay, so let's get right into it. Let's talk about why sleep apnea patients, especially those who are on CPAP, usually need a support system. And what I mean by support system is usually just a group of individuals that can help you deal with your sleep apnea and your CPAP use, in the long term. So there's three different types of support systems you can utilize in your life. First is a professional support system, and these are made up of individuals that are very educated in sleep and sleep disorders, or also very educated in CPAP and the issues that come along with CPAP. So these are people like sleep specialists, sleep technicians, nurses, psychologists, even people who work for CPAP manufacturers are very handy. The next group of individuals is going to be social groups. So this is your social support. And the reason I always recommend being being in a social group or joining a forum or online or, joining a Facebook group is because, you may have a support system in your family, but your family isn't necessarily also going to have sleep apnea. So it's going to be a little bit more difficult for them to relate. So being able to talk to other people who are struggling with their sleep apnea, are struggling to get used to using their CPAP, and just kind of talking through things and kind of relating to each other is very helpful. And it's also very motivating to help you consistently use your CPAP. And then finally, it's going to be friends and family. And this is really for the more emotional, moral support. So they might not necessarily understand what you're dealing with, but they're the people who can, support your mood or, support you when things are not going right. They're going to be kind of your first line of defense. So let's circle back and talk about your professional support system. Who should be in your professional support system? Well, number one is obviously going to be your sleep specialist and the staff at the hospital or sleep clinic where you had your sleep study. So most of you who have sleep apnea or have been recently diagnosed have gone through the process of getting a full sleep study done. And it's not the most comfortable process in the world. Whether you've had it done in a hospital or at home, you're always going to be working with a physician or a sleep clinician or a sleep technologist who is going to be able to guide you and educate you about your diagnosis and kind of give you an idea of what to expect moving forward with your treatment. So if you are just getting started with your sleep apnea treatment and you're having issues with your machine, or you're still having symptoms, or you're having bad side effects, those are the individuals you're going to want to go to first. You're going to want to get into contact with the clinic who did your initial sleep study. So especially the sleep technicians. So these are the people who set your study up, connected all the wires. They're incredibly knowledgeable about every single thing that typically happens to somebody who's just starting off on a CPAP. So they've heard all of the side effects, all of the technical problems that come up, and they almost always have an answer for, how you can solve those problems or how you can reduce those symptoms. They're a really good resource. And the nice thing is, doctors don't necessarily have a lot of time, but sleep technicians are usually more available. Oh, we've got a question coming through from Bob. I have come to appreciate a higher pressure than previously used. This is common. The apneas and hypopneas are under control at a lower pressure, but I've found the higher pressure of 13 to 15 very pleasant. I don't hear that very often, but sometimes you just get used to something, whether it's a high pressure or a lower pressure, or you just feel like you can breathe better with a higher pressure, regardless of the fact that the lower pressure might be working for you. So no, it's not super common, but it's not unheard of either. And I don't necessarily think it's a bad thing as long as your doctor thinks it's okay and it's safe and it's not causing you any issues. Okay, so what were we talking about? We were talking about technicians. They're a really good resource to understand and troubleshoot like all the issues you're having with your CPAP, including just, getting used to using your CPAP. They have tons of tricks and tips. And I've gone over a lot of those tips and tricks in previous webinars. I'm happy to discuss them again, but they're a really good first line. And so another group of individuals from a professional standpoint would be the manufacturer of your CPAP machine. So most CPAP machines are very similar, but technically they can be slightly different. And if you have issues with like your machine not working, or you have issues with your tubing or mask, your manufacturer is going to be a great resource for understanding your options, for troubleshooting your machine, or, improving your overall experience. So one issue that comes up often is initially people will go on CPAP and their pressures are fine, and their pressures help them breathe pretty well and reduce their sleep apnea. But over time, their sleep apnea can get worse and their pressure isn't sufficient anymore. So you can talk to the manufacturer about having your machine adjusted. Okay, we've got a few more questions. I have regular OSA. When you lose some weight, do you recommend a new sleep study? Yes, sometimes. So, obviously, obstructive sleep apnea is correlated with weight. So, the more overweight you are, the more likely you are to develop sleep apnea. And that's because fatty tissue deposits on your neck. And this can cause excess mass basically around your upper airways and make it more likely for, those airways to collapse in on themselves and reduce oxygen getting into the lungs. Now, a large proportion of people who have sleep apnea who are overweight, and I mean specifically obstructive sleep apnea, not central sleep apnea, that go on to lose weight will either see an improvement in their sleep apnea or a complete elimination in their sleep apnea. Most people will know whether their sleep apnea has improved once they've lost weight because they'll be experiencing less symptoms. Yes, by all means, if you feel like you've had a drastic change, then another sleep study may be due. Now, I will say that might not necessarily mean that you have to go do an overnight sleep study at a hospital again. You may just opt for something like using a pulse ox, for instance, to monitor your blood oxygen levels, or doing an at-home sleep study. There's tons of technologies available that are able to detect whether or not you're having sleep apnea that don't involve going to a hospital and having a full overnight sleep study. Okay, so I'm just going to go over a few more things and then I'll answer some more questions. You guys are great. I love your questions. So as far as like technical support, so technicians, doctors, other individuals, obviously it's going to be your primary care physician, because you're going to be primarily working with them when it comes to health issues. If you're emotionally affected by your sleep apnea, or you're really stressed out about using your CPAP or really struggling, a therapist is also a really good option because they can help you learn techniques to deal with the stress. And, people with sleep apnea are at a much higher risk for developing things like depression and anxiety. So just having a therapist that you can talk to once a month, it can be really helpful and just really help keep your mood upbeat and keep, you very positive, and can also help you work through the initial stressors of adjusting to your CPAP. Okay, so that's the professional side. Let's quickly talk about the social side. So obviously you're not going to be in communication 24/7 with your professional support team, but you can keep a social support team handy if you have questions that you want answered, or you want to relate to people. You want to say, hey, this is happening to me when I wear my CPAP. Does it happen to anyone else? So social forums like Facebook groups or Reddit forums, or messaging boards that deal specifically with sleep apnea and using CPAP are an excellent resource, because people are genuinely very helpful and very willing to have a conversation. And if you're having issues, it's just so nice to know that other people in this world are having the same issues and you can relate, because sometimes when you have a chronic illness like sleep apnea, it can feel like you're very alone in the world. So, even though these people might be, on the other side of the country or the other side of the world, still just being able to talk to them and relate with them is just a massive way to just feel uplifted and more confident about going through the sleep apnea treatment process. And then finally, of course, your absolute immediate support system are going to be the people who are very close to you. So these are things like friends, family, and coworkers. And even though they might not completely understand what you're going through, they're really the people who are going to be, the shoulder to cry on, or the ear that you can talk to when you're really struggling. And it's just nice to have somebody who can, let you filter and let you talk about all your issues, and be, not judge you, and just be there, and they care about you. So combining those three levels of support is going to be a massive benefit to your sleep apnea treatment in the long run. Okay, I'll answer another question really quick. I've been struggling with headaches, dizziness, and chest pain every morning for over a year since using the recalled Philips CPAP. I've gone from the CPAP to the BiPAP to the BiPAP and now ASV. I don't have these symptoms prior to using the Dream Station? Could those symptoms be from off-gassing Dream Station? Okay, so you're asking whether you think the Phillips issues with the lung infiltrants is potentially causing these problems. I wouldn't say no, but it's really difficult to say. And so, I mean, there's a variety of reasons why you can have headaches and dizziness and chest pain in the morning. And to be quite frank, sleep apnea by itself causes those symptoms. So, morning headaches are a really common symptom of sleep apnea. The more severe your sleep apnea is, the more likely you are to have morning headaches. Chest pain, maybe that could be due to gasping for air or just struggling to breathe. But what I would recommend is if this is an ongoing problem for you and you're finding that even with your sleep apnea treatment, you're still having these problems, it's going to be worth talking to your primary care physician to maybe get it checked out, because there's dozens of reasons things like that can happen. Is it related to the Phillips? I don't know. I can't say for sure because those symptoms are typical in a lot of disorders and a lot of health conditions. So, it's important to go talk to your doctor. Chest pain, always a big red flag. That's never something you should ignore. If you're having consistent chest pain, you should talk to your doctor. Okay. So we've just talked about your support system that you should keep around to, make sure that your CPAP journey is as successful as possible. The other topic I wanted to talk to you about today are some of the do's and don'ts of using a CPAP that if you follow, you're more likely to be successful with your treatment in the long term. And so there's a lot of do's and don'ts, but I think these are the most important. So let's start with a do, things you should absolutely do when you're using a CPAP. Number one is allow yourself enough time to adjust to your CPAP when you first start using it. So clinical studies have found that it takes people on average 4 to 6 weeks of continuous nightly use before they get used to using their CPAP and before they're able to actually sleep soundly throughout the night. And so that means wearing your CPAP for at least 4 hours every night on average. So you don't necessarily have to wear it for the full night, but you do need to wear it for at least half the night. Now, consistency is key, and perseverance is what is actually going to get you over the initial hump of using your CPAP. So what I recommend, and we've gone over this. I've done a webinar on how to get used to your CPAP. The previous webinar is posted. If you want to go check it out, it's on my page. But things like, trying to use your CPAP during the day when you're just sitting and relaxing and not really doing anything important, just to allow your lungs and mouth to get used to using it. Using the ramp feature as much as you need to. And if you're having any uncomfortable side effects or issues, talk to your sleep technician, talk to your doctor, because they can help you troubleshoot those. But remember that the longer you use it, the more likely you are to use it successfully. Okay, and let's talk about a don't. Do not attempt to fix your broken CPAP by yourself. So CPAPs are a machine, right? They're technology, and sometimes technology goes wrong. We can see this with the Philips recall. Now, that's a major issue that a lot of us sleep health professionals are pretty, miffed about. We're very angry about that situation. But even if you don't have a Philips, you may run into some technical problems with your CPAP now again. Now, there's a lot of people online telling you how to troubleshoot your CPAP, but the reality is that 9 times out of 10, what you think is wrong with your CPAP isn't what's wrong with your CPAP. And if you try to fix it or run chemicals through it or change out tubing, you're going to risk doing more damage to your machine. And the other issue is you're pretty much guaranteed to void the warranty on your CPAP, which means that if it does break down, you won't be able to get it replaced. The company is less likely to help you out. So if you have an issue with your CPAP machine, you should contact the manufacturer first and talk to a rep who can either talk you through how to fix it, or, they will take your machine and fix it themselves. Okay, The next do is clean your machine regularly. This is so important, and so many people do not clean their machine. And when I mean regularly, I mean at least once a week. So, you're breathing into a mask, and when you breathe in and out, bacteria, dust, particles enter the tubing and enter the machine. And when bacteria and other microorganisms like fungus enter the machine, they can build up and they can cause a biofilm. And you don't even realize it's there. It's completely naked to your eye. You can't see it, but over time it can build up. And if you're not cleaning your machine regularly, it can build up to levels that are quite toxic and bad for you. And that can result in things like infections, especially lung infections, and irritation on the face, and skin infections, fungal infections. It's just nasty. The other thing is that if your machine is consistently getting dirty and you're not cleaning it out enough, it can actually break down the machine itself. And if your manufacturer finds out that you haven't been cleaning your machine consistently and it breaks, then it's likely going to void the warranty, and they will not be able to fix it for you without you having to pay a bunch of money. And so cleaning your machine is absolutely essential. Your manufacturer will provide you with specific directions of how to clean your machine, and you need to follow those directions carefully. Don't use chemicals that are not made for CPAP machines. Don't use, harsh scrubbers like a sponge. Just clean it the way the manufacturer says, and you should be fine. Okay. Another don't is never use incompatible parts on your machine. So if you do have to replace something on your machine, such as tubing, mask, a dial, don't use parts that are not made by the manufacturer or not recommended by the manufacturer. Again, this is just common sense, but some parts will not work efficiently with the machine you have, and so you will not get the proper therapy. Or, if you use improper parts, again, it could break or damage your machine. So just avoid it. And if something breaks, just contact your manufacturer immediately. Usually these things fall under your warranty, and they'll be able to replace them in a timely manner. Okay, do's, another do. Do change your filters regularly. So just like cleaning your machine, you need to change your filters consistently. Every machine is different, but most of the time manufacturers recommend that you change your filters at least once a month. So, like I was saying earlier, dust gets into your machine, dirt, grime, and these filters really keep your machine clean, and they also keep your lungs clean, because the last thing you want is things like dander or dust or pet hair or a whole range of other nasties getting into your lungs, because that is very dangerous. It's one thing to swallow those things where they can get broken down in our stomach acid. It's another thing for those things to enter your lungs and cause an infection. So changing out the filters is important, and also using the correct filters. So before you go out and buy filters from a third company, just make sure, double, triple check that they're actually going to work for your machine. Okay, we have another question. I understand that sleeping in certain positions can help a lot. Have there been any studies on this? Yes, dozens and dozens and dozens of studies. Sleep apnea, interestingly enough, so in the field of sleep apnea is one of the most well-studied sleep disorders in the world. We understand so much about sleep apnea compared to other disorders and compared to other health conditions. So about 50% of people with obstructive sleep apnea have positional obstructive sleep apnea. And that means that they only have sleep apnea symptoms in certain positions. Now, usually, like 9 times out of 10, this is when the individual is lying on their back. And this is because when you're lying on your back and your muscles relax when you fall asleep, gravity is pulling all of the tissues in the back of your throat backwards. So when those tissues relax and gravity is pulling them backwards, it makes it more likely that those tissues are going to collapse and obstruct your airways. And so 50% of people find that when they sleep on their side, they don't have this issue. And it's a really easy way to solve your sleep apnea. It's the same for snoring and upper airway resistance syndrome. Now, you really have to get a sleep study done to determine if your sleep apnea is positional and whether it's appropriate to correct your sleep apnea by changing your position. Some people will still, will be most severe on their back, but they'll still have sleep apnea symptoms on their side. Those people generally will need additional therapy. Okay. Any studies on CPAP therapy improving insulin resistance? Yes, absolutely. So again, going back to sleep apnea being one of the most well-researched sleep disorders in the world, we also understand how sleep apnea affects a wide range of health disorders, especially chronic conditions and metabolic disorders. So we know that sleep apnea massively raises your risk for cardiovascular disease and metabolic disorders like type 2 diabetes. And the reason for this is because sleep apnea is inflammatory and it's also sleep depriving. And we know that when the body is deprived of sleep, we become insulin resistant, and that can eventually go on to lead to full-blown diabetes. So we also know that people who successfully are treated with CPAP machine, on average, become less insulin resistant, and some people even go on to no longer having any diabetes or issues with sugar. This is especially true if you combine the CPAP use with things like weight loss, healthy diet, and exercise. But generally speaking, if you have insulin resistance or diabetes and you're successfully able to treat your sleep apnea with CPAP, we would expect to see an improvement in your diabetes symptoms most of the time. Okay, so let's quickly go on to some of the other do's and don'ts. Okay, let's go to a don't. This is really important. Never use tap water in your water tank. So most CPAP machines come with a humidifier, and you have to fill it up with water to get the humidity you need to keep your airways nice and moist. It would be very easy and convenient if we could just fill up our humidifier with tap water, but there's several problems with that. One is tap water is full of minerals like calcium and magnesium and iron that can build up in your machine and damage your machine. So you don't want to cause any damage to your machine, because if you do send it to the manufacturer to get fixed, they'll quickly find out that you were using tap water and it will void your warranty. The other reason is because even though we live in a very well developed country and our tap water is safe for us to drink, it still has trace amounts of bacteria at safe levels to consume, but not at safe levels to breathe. So you're placing yourself at risk for infection from various bacterias and funguses. So you just want to avoid. Instead, you should always use distilled water that you buy from a grocery store, for instance. Almost all grocery stores have distilled water. So you'll just want to keep a few gallons of that handy. It's really cheap. And always use that for your tank. Okay. Next do is clean your mask. So just like everything else with the machine, you do have to clean your mask, and we are recommending that you actually clean your mask daily. And what we mean by daily is you don't necessarily have to wash it with soap and water every day, but you should wipe it down, maybe run it under tap water. Just make sure that you're getting any bacteria or debris off of your mask so that it can't go on to irritate your skin or cause infection. Now, once a week, I would definitely recommend cleaning your mask with a light dish soap and just warm water. You don't need to use any harsh chemicals or anything like that. You're simply trying to strip off the dirt and bacteria, just making sure you rinse it and dry it really well afterwards. Of course, if your mask is appropriate for that. Some masks have fabric padding and sponges, and you may need to ask the manufacturer how they recommend that you clean your mask. Okay, another don't. Don't change your mask without help or advice from your technician. So one of the biggest hurdles when you initially start on CPAP is trying to figure out what mask is going to work for you. So it's a lot of trial and error of just trying different masks, trying different sizes, trying different types, trying different straps. And it can get really frustrating. And, you may feel like, well, I'm just going to order a bunch of masks online and try those. Sometimes that's okay, but the mask you use has to be very appropriate to your machine and also your situation. So not every type of mask is going to actually work for you. For instance, people who tend to breathe through their mouth at night shouldn't be using a nasal mask or a nasal pillow, because what's going to happen is if they have only a nasal mask or a nasal pillow, as soon as they open their mouth and they're unaware that they're opening their mouth, air is just going to flow right out and it's not really going to do anything for your sleep apnea. So they will be more appropriate for a full face mask. And you also need to know things like nasal sizes and face sizes and what mask is going to be less irritating and more comfortable for you. So just always talk to your technician before you go out and waste money on a mask. Okay, Stan is asking, what about those machines that claim they clean? Yeah, so the technology is getting better. Some machines do self-clean, but it's not like you could just allow them to clean every time forever. There would still be some maintenance involved. You would have to actually manually clean it every once in a while. The manufacturer will always come with instructions on how to do that. So regardless of what type of machine you'll have, you will eventually have to clean it. And usually it's more consistent than you think it would be. Okay. Another do. Make sure you're speaking up about your sleep apnea symptoms. So it's an unfortunate reality that when people are placed on a therapy like CPAP, sometimes their doctors will just prescribe them the CPAP and send them on their way, and they're expected to be treated for the rest of their life without any issues. But the problem is, like, nothing is perfect. No treatment is perfect. So some people, their CPAP may work great right away and they're good to go. Other people, their pressures might not be quite correct, or their mask might not fit perfectly, or there's a whole range of other issues that would lead to your CPAP not working properly and not treating your sleep apnea symptoms. So if you're still having sleep apnea symptoms, such as excessive daytime sleepiness, morning headache, increased urination, brain fog, you name it, even though you're on your CPAP, it's really important to talk to your doctor again about reassessing whether your CPAP is actually working for you and whether you need your pressures adjusted, or if you need a new mask or need to go on a new machine. The other thing that's really important is sleep apnea can get worse as we age. So maybe you were prescribed a CPAP in your 40s and it worked well for you in your early 40s, but the time you get to your 50s or 60s, things can change. Your sleep apnea sometimes can get better depending on things like health and weight loss, or what often happens as we get older, it can get much worse. So if you've had your CPAP for 10 years and you're suddenly feeling like it's not working, then you may need to reassess whether your CPAP is actually solving your sleep apnea. So always keep that in mind. I always say, check yourself every couple of years. You don't have to go in for an overnight hospital study necessarily, but you could do a home test, or you could get a pulse ox and look at your blood oxygen levels. You just want to stay aware of where you're sitting with your sleep apnea symptoms. Okay. Another don't use another person's machine. So, and I understand why people do this, right? I have a lot of empathy. They're expensive. Sometimes insurance won't cover the one you want. You've got Philips, which has just recalled all their machines and they're not replacing anything. So the temptation to get a secondhand machine or use a friend's machine is really high. In some cases, that's okay. If you get a refurbished machine that has been refurbished by a CPAP company, that's usually fine. What's not fine is buying one online, like on Facebook Marketplace, or using your friends, because you don't. First of all, you don't know whether that machine is going to be appropriate for you. A lot of CPAP machines are set to the pressure needed for that individual and not you. So you may spend money on something that doesn't even work for you. The other issue is we can clean our machines often and usually keep them pretty sanitized, but they're never going to be fully sanitized. So bacteria and fungus that one individual's immune system might be used to may be a biohazard for you because your immune system is not exposed to it. And it also didn't come from you. So it also increases your problem for lung infections and other problems. And then finally, if you do get a secondhand machine and you don't get it from an actual CPAP company, if that machine breaks down or there's problems, it's very unlikely that you're going to be able to get it fixed without having to pay a ton of money to do so. So financially, it's almost not even worth it. But like I said, I understand why people do it. It's getting super popular to buy secondhand machines now. I consult with a lot of people who go through that process, but just keep those things in mind. Okay, the final do is speak up about your side effects. So, yes, CPAP, like any other medical treatment, can have side effects. Some common ones include dry mouth, sore throat, bloody noses, chapped lips, sore face. There's a big range of side effects. And one of the common issues that I see all the time is people will try to deal with these things themselves and don't realize that they're having these side effects because something is not right with their treatment. Their humidifier may not be working well. Their mask might not be fitting. They might have some issues with their mouth opening at night. So it's always important that if you're experiencing excessive side effects that aren't going away, that you just talk to your sleep technician or doctor so they can troubleshoot those things for you, because you shouldn't have to live with those issues. Okay. And our final don't of the night is don't give up on your CPAP. So CPAP has a very low compliance rate. And what I mean by low compliance rate is people tend to give up on it very quickly, like within the first week or two of using it. And I get it. CPAPs are difficult to use. They can be uncomfortable at first, but it's like I said earlier, you just need to give yourself time to adjust and use your support system and talk to your doctor so that you can push through that initial 4 to 6 weeks. And hopefully you'll get that, get over the hump that you need. If you absolutely cannot get used to your CPAP, you've tried everything, then you've got to go advocate for yourself to try another treatment. There are other treatments available, things like oral appliances, surgeries, the Inspire device. So, even if your CPAP doesn't work, that doesn't mean there's no hope for treating your sleep apnea. Okay. So, I think we've covered the big ones. There's a lot of other do's and don'ts. If you do a quick Google search, you can find most of them. So I really hope you enjoyed this webinar. It's nice to just remind people about the things to make their therapy process easier. I'm happy to answer any additional questions you guys have below. Like I said, doesn't really have to be related to this webinar. If you have comments or questions about sleep apnea in general, or other sleep disorders, or other things about sleep in general. Again, if you're interested in joining our mailing list to get alerts about these webinars that I do weekly, drop your email below. Or if you're not, if you don't feel comfortable with dropping it in the comment section, you can send me a private message. We also will send you a guide from the seminar that I've written out so that you have that, if you'd like to refer back to it later. So any questions, guys, feel free to drop a comment below. Happy to answer. I'll just give it a few minutes. And if nobody has any questions, that's okay. Please join me again next week, next Wednesday at 8:30. I always look forward to talking to you guys. Great questions tonight. No problem. And again, I just wanted to say if you are struggling with the Philips recall, I am really sorry that you're going through that. And I know it's really difficult. Like I said a million times before, the sleep health community is very frustrated with Philips right now. And if you're looking for other options or if you're not sure what to do, shoot me a message. I'm more than happy to talk to you about your options. Okay, guys, I think that's it for tonight. It seems like there's no other questions. So again, thank you so much for joining me. I will see you guys next week and take care. Bye-bye.